Hello everyone. So let us study today about endometrial CA. This is Dr. TS sir. Kindly subscribe to my channel for more such videos. Okay, so let us study today about endometrial CA staging. Again, all staging contains stage 1, stage 2, then stage 3, there comes stage 4. Okay, so stage 1, okay, which is very limited to that of, see, this is our uterus, cervix, then the fallopian tube, then comes the ovary. Stage 1 is limited to uterus plus ovary. Okay, in this stage 1, again stage 1A, stage 1B, and then stage 1C. 1A again divided into A1, A2, and A3. A1 is, it is involvement of the endometrium, but it is not aggressive type and there is no lymphovascular space invasion. So it is no lymphovascular space invasion. Whereas stage A2 is less than 50% myometrium involvement is there. Again, it is not aggressive type and there is no lymphovascular space invasion. Okay, and stage A3 is again same thing, less than 50% of the myometrium is involved, but it is involving the one ovary, spreading to the one ovary is there, which is again low grade histology. So low grade histology is endometrial type. Okay, and then capsule of the ovary is intact. Capsule is intact. So if it ruptures, again stage differs. If the capsule is intact, it comes under stage 1A3. This is the newer difference when compared to the previous endometrial CS staging. Here, the ovarian involvement without capsular rupture and low grade histology comes under stage 1A3. Whereas stage 1B is more than 50% of myometrium is involved. But again, it is low grade endometrial type of cancer. That means it is not aggressive type without lymphovascular space invasion. Okay, whereas 1C is, which is aggressive type. Remember, in all in the endometrium CA, all C is stage 1C, stage 2C, all are aggressive. So it is aggressive type, but here it is confined to the endometrium. Aggressive type which is confined to the endometrium. Then coming to stage 2, again stage 2 is again divided into stage 2A, stage 2B, and then stage 2C. Okay, stage 2A is involvement of cervix stroma. From the endometrium, it has come to the cervix stroma involvement. So, but it is only stroma without glandular involvement, not glands. It is only the cervical stromal involvement. Again, it is not aggressive type and there is no lymphovascular space invasion. Lymphovascular space invasion in endometrial CA comes under stage 2B. Okay, stage 2B is lymphovascular space invasion is present. Okay, so it should be not focal, it should be substantial. That means it is involving more than or 5 lymphatic vessels channels. So it is blood vascular channels. Lymphovascular space invasion substantial type present in stage 2B. And 3, already told, any C is related to aggressive type. Again, it is aggressive type which is confined to that of the myometrium. Okay, then coming to stage 3. Stage 3 again divided into stage 3A, 3B, and 3C. 3A again divided into A1, A2, B again divided into B1, B2, and C again divided into C1, C2. Okay, so A1 is, I told already, ovary involvement, but subcapsule ruptures comes under here. So either involvement of ovary or involvement of fallopian tube. A2 is involvement of subserosa or involvement of serosa. Again, B1 is involvement of the vagina with the parametrium, vagina or parametrium. Whereas B2 is involvement of pelvic peritoneum. Okay, and C1 is involvement of pelvic group of lymph node. C2 is involvement of para-aortic group of lymph node. Again, these both are divided into again 1 and 2. Okay, depending on what type of metastasis. It is micrometastasis. Here it is macrometastasis. Same again, 1 and 2 para-aortic group of lymph nodes. C2, micro and macrometastasis. Remember, the thing what differs here is C2, here involvement of para-aortic group of lymph nodes up to the level of renal vessel. Okay, up to the renal vessel. This is the important thing, up to the renal vessel. Okay, pelvic group of lymph node means what are the pelvic group of lymph nodes? You know, pelvic group of lymph nodes means, so it is iliac group of lymph nodes, external iliac group of lymph nodes, internal iliac group of lymph nodes, common iliac group of lymph nodes, or obturator group of lymph nodes. All these constitute pelvic group of lymph nodes. Okay, then coming to the stage 4, see in stage 4, unlike to the other cancers, here we have three stages: A, B, and C. Okay, A involvement of again bladder and bowel mucosa. Okay, bladder and bowel mucosa. Whereas B is, here I told up to the renal vessels. Now here we have told pelvic peritoneum involvement is stage 2B. Here it is abdominal peritoneum. Similarly, like CA cervix staging, where I told CA ovarian staging, where we told up to the pelvic intraperitoneal structures, extra pelvic structures. So there in ovarian CA, pelvic structures is stage 2 and extra pelvic structures is stage 3. Here up to the pelvic structure is stage 3. Beyond the pelvic peritoneum, that is abdominal peritoneum, is stage 4 in endometrial CA, abdominal peritoneum involvement. Okay, bladder, bowel, abdominal peritoneum, and here comes the distant metastasis. So this is in brief about endometrial CA staging. So hope you liked this video. Kindly do comment, like, share and subscribe to my channel. This is Dr. TSR signing off. Thank you.